I'm live. Hello, can you guys hear me okay? I'm having technical difficulty here. If you can hear me okay, just let me know. I'm live. Hello, can you guys hear me okay? All right, I think we're live now
I'm having
and
technical
audio is
difficulty
good.
here.
Um if you can hear me okay,
All
just
right.
let me know. Here we go. Sorry for the technical difficulty. We're gonna restart
I'm
again.
live.
All right. So welcome to the
Hello, can you
show.
guys
I
hear
am
me
your
okay? I'm
host.
having
All right. I think we're live now
I'm having
and
technical
audio is
difficulty
good.
here.
Um, hello. If you can hear me okay, just please comment. I don't know what happened here, but I'm having a real difficult situation here. Hello. If you can hear me okay, just all right. Here we go. I don't know what happened here, but I'm having a real difficult situation here. All right, here we go. So, welcome. Good morning, good afternoon, good evening, everyone. This is the fourth attempt so I could go live. There are some technical difficulty with the audio, but I hope this time you can hear me now. Um, Welcome to the third episode of Ang Artimo, and I am your host, your respiratory therapist, Michael D. Peralta. And today's episode, we have Mr. Lynard Higoy from Alberta, Canada, live, um, joining us live here on our show. Uh, would just like to greet everyone, to all our subscribers, all our followers, all our supporters that are supporting the Ang Artimo channel, that are supporting the respiratory therapy profession. Would like to thank each and every one of you for your support, your continued support for our show and the profession. Thank you so much. Shout out to all our followers and viewers from the Philippines, from the Middle East, Singapore, Europe, and the United States and Canada. Welcome to our show, and thank you for joining us today. Give you a chance, sorry, to once again click the link and follow the new stream link. This is what we're using now because of the technical difficulties we're having earlier. So bear with us here, folks. Thank you for your patience. Um, Here we go. Next one is towards the or after the presentation of Mr. Leonard Higoy, we will have a game show or a quiz B or a sputum bowl, whatever you call it. But Mr. Leonard Higoy will be giving out 5,000 pesos to our lucky grand winner for the show. And for our second and third placer, we will, our Timo will give out the 1,000 pesos, Philippine pesos each for the second and third participant. Because we didn't have a winner for our episode two. We didn't have a winner for our episode two. So we will be giving two prizes for this episode, including Mr. Leonard Higoy's 5,000 pesos um, lucky pot. So, all right. So, shout out also to all our new respiratory therapists registered in the Republic of the Philippines, or RTRPs, for passing the 2021 RT license board exam in the Philippines. Congratulations. We are so proud of you joining the ranks of the new respiratory therapists in the profession, and we can't wait for you to join us, with our current fight in the pandemic. Hope you guys are doing well, celebrating safely with your friends and families, and we are so proud of all of you. And for those who didn't make it, there's another just you can just always retake the test, review more, and we are 100% here to support you, and we wish you luck, and we pray for your next test to be a successful one, to be RTRP soon. So we are 100% supportive of everyone and congratulate again everyone. So we are now gonna invite Mr. Leonard to join us on our show, since we are already 27 minutes after our start time. And I do apologize for the time confusion due to spring forward rule that we have here in the United States. So basically, we lost an hour. That's why we have time difference or difficulties or changes for the Manila and our Dubai time. Okay, so once again, thank you for your support. Thank you for joining us. And here we are now live with Mr. Lynard Higoy from Alberta, Canada. I do apologize if I'm mispronouncing your name.
No,
So,
that's actually correct.
yeah.
Did we fix the audio?
Yeah, we did. We did. There's just
Okay, perfect.
I have the typical whatchamacallit, the typical reset, turn off, turn on thing.
Okay, got
So
it, got
we are
it, got
now
it.
live with our audio on. So thank you for joining us today, Leonard. Welcome
Yeah,
to the
good evening
RTMO show.
or good morning, I guess, to our Filipino viewers, and I guess as well for Middle East. So I'm Leonard. I'm practicing RT here in Alberta, Canada. So
Awesome.
I'm presenting today.
Mm-hmm. Yeah, thank you for that. So, Mr. Leonard is from, I think it's Leonard, not Leonard, huh? Because of the Y.
Yeah, no, it's like Leonard Skinner. It's like Leonard Skinner without the Y.
Yeah.
But you can call me Leonard
Mm.
or Leonard
Mm.
as long as it's not Lynard. I don't really like that.
Yeah. So, all right, Mr. Leonard will be presenting after our question and answer portion here. He will be presenting meter MDIs with spacer versus the nebulizer, or basically our
Yeah.
inhalers versus nebulizer. So, let just stay tuned with us, and we will get to that presentation in a bit here. But since this show is about ang Artimo, for our non-Filipino viewers, so just to explain what's ang Artimo, basically ang Artimo, it means your RT, or your respiratory therapist. RT, or ARTE, arte, means kind of, you're kind of pretentious, or kind of, we call it kind of pretentious. So we just kind of, put a twist in it. But basically, what we mean is your respiratory therapist. So the goal here is we get to know our guest respiratory therapist, and he will present later. That's just the difference, because we are not a formal, conference here. We're just trying to have a little fun here and get to know our respiratory therapist that you can't get on a formal conference. Anyway, our first question is, Mr. Leonard,
Okay.
briefly introduce yourself. So, where have you gone RT school? What are your current credential? And where do you work now, and what do you currently do?
Okay. So I did my Bachelor of Medical Rehabilitation in Respiratory Therapy at University of Manitoba. So if you guys are familiar with the Canadian city, Winnipeg, I'm actually originally from Winnipeg, well, from the Philippines. I moved to Winnipeg. And then I went there, accidentally, and fell in love with respiratory. And then from there, I worked for the Winnipeg Regional Health for 4 years. But then I have to move to Alberta to follow my, back then was my girlfriend, and now we're married. So my wife. Credentials, I have a CRE, so that is a Certified Respiratory Educator. That is an extra credential if you want to go community side of respiratory therapy. I also have a Certified Tobacco Educator, so that's a CTE. that's more on like smoking cessation programs and such. Currently, I'm doing my management education, so I'm in grad school. I'm doing a grad diploma in leadership and management for from Athabasca University Faculty of Business, and then at the same time, I am fulfilling my conditional course to get into the Master of Arts in Interdisciplinary Studies with a focus on work organization and leadership. So I'm now more on focusing on the leadership and management side. But I still love to be a frontline clinician right now, especially with COVID-19. I feel like we got the spotlight with this pandemic. So yeah, that's my background and that's my credentials
Mm-hmm.
so far.
Awesome. You know, not familiar with the or most particularly or more particularly the Alberta side of respiratory therapy. So you mentioned
Yeah,
right.
it's quite different the states.
Right. So if if you can educate me, I know you're familiar with the U.S. side of it. So we sit for NVRC RRT. What is the equivalent for the RRT credential in Alberta? Or
So we write a national exam. It's called CBRC. It stands for Canadian Board for Respiratory Care. So it's pretty much in the Philippines like the PRC
mm,
that does the board exam. Here it's the CBRC. It is a national exam. But then once you pass the exam, you have to register yourself to the college in which province you want to practice.
mm,
So when I was practicing in Manitoba, I have to register with MARC, Manitoba Association of Respiratory Therapists,
mm,
or register respiratory therapist. And then when I move here, I have to register for CARTA. So it's a College of an Association of Respiratory Therapists of Alberta.
mm,
Different province has their own different jurisdiction.
mm,
As far as I know, there's only a couple of province that is not regulated. I'm not sure with the other one, but for sure, British Columbia, where Vancouver is,
mm.
I don't think they are regulated as of the moment. They don't have their own college, so they have to register themselves. Correct me if I'm wrong. With the CSRT, so that's the Canadian Society of Respiratory Therapists.
Mhm.
So it depends on where you want to practice.
Awesome. Thank you
Yeah,
for giving us
yeah,
that education. With the different provinces, it's same with the United States, different states, different rules.
exactly.
Right. Some states don't have, regulatory exam, even though the national,
Oh, really?
right,
Yeah.
even though the national is, what do you call it? Even there's a national examination for it. But
Oh,
yeah,
okay.
most states here do are credentialed respiratory therapist or respiratory care practitioner. All right, so moving on. So we, on social media, which I am very active. And people are
Yes.
do aware of that.
And thank you for doing that. No, it's good.
Yeah,
It's good to promote our profession and help our kababayan and
right.
such, especially with this pandemic.
True. That's what keeps us connected now. So social media.
Yeah,
Let's admit it.
exactly.
All right. So I've seen one of your posts and I'm very well aware that you have been elected on such a position. Please tell us more about that, sir.
Yes, and I think it's an achievement not only for me but for us Filipinos because I think finally we got in a leadership role or an important leadership role. I mean, like we know that there's a bunch of Filipinos in the healthcare profession, especially nursing, other professions like pharmacy, physio, and then of course respiratory therapy. But if you compare the ratio with respiratory therapists and nurses, there's so much. But I mean, it's still an achievement to think that I got elected in a sense that it's so fulfilling that I'm also representing the other Filipino healthcare professionals.
Mm-hmm.
And aside from getting elected in my young age,
Mhm.
sort of like the youngest member of the council. I don't think this is only my achievement, but I think it's also the achievement of all Filipino RTs, but not only RTs, again, as I said, healthcare professionals. So this position is pretty much sitting on the council and governing the respiratory therapy profession in the province of Alberta.
Mhm.
So I have a 3-year term, and I'm the director till 2023, I think. I'm not quite sure, but around there.
Yeah, very proud of you for that wonderful achievement and having a representation for our kababayans. We can say, a Filipino Canadian, a
Exactly, yeah.
full blooded Filipino Canadian who's in a leadership position representing the respiratory care profession, but also, as you mentioned, not only the respiratory, but also the healthcare profession as a whole. So,
Yeah, as I said, yeah, the social media helped me, and then our fellow kababayans, nurses, Filipino nurses that know our RRTs in their sites, they help me. So, I mean, yeah, it's a big achievement for us.
yep, very proud of you, and I think a lot of our kababayans are, all proud of you, and thank you for doing that. And we wish you luck on your journey as a director at large for that organization. Yep. Moving on. Um, you have mentioned before that that you were educated in Canada for your respiratory care degree or your
Yeah,
reha- uh, medical rehabilitation, correct?
yeah, Bachelor of Medical
Right.
Rehabilitation.
And also, my question is, was this your first job or your first career? And living on the western side of things, you can work or you can study later, right? And you can do something else
Mm-hmm.
first. Was this your first job or first career?
Yes,
Mm.
because I moved here when I was young.
Mm-hmm.
And then, I'm ready to go to college. Just so you know, guys, I worked at McDonald's when I was young. That I think would be my first job,
Yeah.
which actually helped me out so much
Mm-hmm.
because it really helps you out with your organization skills.
Mm-hmm.
I worked at the back end, so I
Mm.
salute McDonald's right there. I don't know if we have to, disclose, promote commercials or,
Yeah.
or products, but yeah. No, yeah, this is my first job,
Mm-hmm.
but as a Filipino and us being good in healthcare, healthcare is really where I want to be for program.
Uh-huh.
My first choice is actually pharmacy, but the
Mm-hmm.
thing though is I didn't get into the cut that year, so I was devastated. I was heartbroken.
Mm-hmm.
But I don't want to stay for another year. It's totally different out here in Manitoba, in University of Manitoba. Your first year, you don't have a course. Then you have to fulfill the program, or you have to fulfill the requirements for a program that you want to go. So luckily, physio, respiratory therapy, and pharmacy is shared the same courses. But I'm aiming for pharmacy. But because I didn't get to the cut, I went to an open house to check physiotherapy program. When I was at the open house and I was the physiotherapy program, then I saw from afar the respiratory therapy booth, and I saw like the 840s. I saw the baby log. Before back then, I didn't know that it was the baby log. I just saw like there's like a bunch of machines and a bunch of ventilators, and then there's a peg lung that was connected to the ventilator, the Jackson Rees. So like I went there, check out the open house. The RT was on the booth, told me to use the Jackson Rees and try to maintain a pressure of 26 and a PEEP of 10, I think, or 5. I'm not sure.
Mm-hmm.
And then I miraculously, apparently, I did that for a good 1 minute. So she told me that I think I'm built for the respiratory therapy program and not the physiotherapy.
Mm-hmm.
So yeah, I was just accidentally in love, and I applied and I got in.
That's good. Quite a journey. That's how we recruit respiratory future respiratory therapists is invite them on, open house, have them practice and make them be interested in the profession. But as you mentioned, we don't have sponsors here. It's okay. But
Okay,
McDonald's,
that's good.
good to know that you work at McDonald's. I did work for McDonald's too. I did work
Right,
for
right. Yeah,
three
McDonald's
months
is so
only.
good.
3 months
Yeah,
only. I couldn't last. I mean, that's hard work.
I
Salute to all our
yeah.
fast
Well, I
food
think
help,
yeah,
workers are amazing. Amazing. You gotta have to be fast. Dedicated to do it. It's a good
yeah.
job. You learn a lot.
I worked there for a year, and I guess like being a Filipino, it's our brand that Pinoy is hardworking. So
Right.
I worked there for 1 month as a regular crew. And then when I got into the RT program, I said I have to quit because I have to go to school.
Mm-hmm.
So I guess they actually doesn't want me to leave. They actually offer me to be the shift manager if I want to stay
Right.
and don't go to college. But I was like, no, university is my priority.
Yeah.
So that was the end for my career for McDonald's. But yeah,
Right.
I,
I,
I love McDonald's,
yeah. That's how they
especially
get
with
you.
the
That's how
yeah,
they get
especially
you.
with the 50% off if you're like an employee.
Yeah.
So I think that's where I gain all my weight from working at McDonald's.
Yeah, that's how they get you. You're leaving, you're a good employee. We'll promote you. Forget
Yeah,
about college. But we are proud of all our fast food workers
yep,
and the managers
exactly,
there. Front and back end of the side of things. You guys feed a lot of us. So, thank
exactly.
you.
Yeah,
Yeah.
they're also frontline workers.
Right, yeah. So that's crazy, but good to know that you have worked to something that is an eye opening before you get into the field of
Yeah.
healthcare. Um, so next question is, you mentioned that you are a community respiratory therapist. What does a community respiratory therapist do in Alberta? And how does COVID affected your job?
Okay. I guess that's another thing because I think if when I notice seeing Filipino or Philippine trained RTs or RTs working in Middle East, Philippines, the states, I noticed that I would say 80%, which is like actually part of our training,
Mm.
80% works in acute care, which is good because acute care, that's where the action is, that's where the adrenaline is. But there's like a certain small percentage of people that actually want to work in the community.
Mhm.
Um, I guess there's also home care, there's community, there's people that works in the pulmonary function testing lab.
Mhm.
Community respiratory therapy, though, especially in rural areas, is quite different. So we're sort of like jack of all trades. We don't work shift work. We don't work 24/7. There's only one RT in each territory. So in 3 counties that I cover, I'm the only RT in that area. And then sometimes we cross train nurses, especially for like oxygen therapy and therapy assistants. So community therapies is more on education
Mhm.
and rehabilitation, and more on community rehabilitation and a lot of education. That's why it's very important that you have the CRE designation
Mhm.
at least, the certified respiratory educator, because you do a lot of like asthma education, COPD education. I run a pulmonary rehab program.
Mhm.
Currently, it's on hold right now because of the pandemic, but I'm actually going to open it as a virtual program. And I think that's going to be the new norm, or a mixture of in person and virtual. Aside from that, we also deal with people on trachs or chronic ventilated patients that can be discharged at home. So, we're the one that take care of them, give them education on how to properly do trach care. Here in Alberta and here in Canada, as you guys know, we're a public healthcare system. So everything can be covered through our publicly funded healthcare. So we also are, I would say, the important profession to assess them for home oxygen.
Mm-hmm.
So one thing to qualify them is through arterial blood gases.
Mm-hmm.
So we're the one that assess them for home oxygen. There's so much. It's like every single day, our days are different. It's just, we don't have the acute care anymore. We don't have the adrenaline anymore. We don't have a person, let's say, got into a car crash and you need to
Mm-hmm.
intubate them. That's far beyond my scope now.
Mm-hmm.
I know I'm young, but I felt like my expertise is actually like talking to people. As you notice, I like to talk a lot. So I'm more on the community side. So that's what the community RRTs actually do here in Alberta.
Mm-hmm.
In Canada, there's also Alberta community RRTs, but I think the scope of practice will be different. But for us, that's pretty much like the bread and butter for us every single day.
Right. Yeah. Yeah. Good to know. Good to know. It's a very broad scope and a really much needed position in the communities having a community respiratory therapist. That's something that that the United States and some counties, cities here in the United States could adopt. But the professional organizations here are working on that too and advocating for the profession. As everybody know, the respiratory therapy profession is very young and it's still blooming even up to this point. So we will get there, and with the COVID-19 pandemic, people have known, or a lot of people know now, what a respiratory therapist does, for our patients and for the community. So thank you for
Yeah.
what you do for all your patients and all your all the people of Alberta in where you work. For sure they appreciate the work that you do and having that innovative pulmonary rehab program that is transitioning online. That's
Yeah,
awesome. Yep. And then
absolutely.
um next question here is you already answered some questions in here, like what's your favorite kind of unit in a hospital, or what's your forte, what's your specialty, and you already mentioned that you love talking to people and educating. So is that right you
Yeah.
mhm.
And I guess for my training, we in Manitoba we got aligned with physical therapy and occupational
Mhm.
therapy. So we share the same faculty, College of Rehabilitation Science. So you could also say that I'm more on like the rehabilitation side of things.
Mhm.
So stroke units,
Mhm.
pulmonary rehabilitation, neuromuscular clinics. So
Mhm.
that's, I would say, would be my scope of practice that I actually like enjoy.
That's awesome. All right, moving on to the next question here. You're young, you mentioned. Can you disclose your age for our audience?
31.
31.
I'm 31.
Awesome. We're young. I'm right there with you.
Yeah, yeah.
So, when you were practicing in the acute care side of the hospital, or when you were in respiratory care school, what's your favorite ventilator?
Oh, that's a good question.
Mm.
The PB, no, what is it? The Evita? I would say that would be the purple one,
Yeah,
right?
yeah,
Yeah, I
yeah,
think that's the one that I like.
yeah. That's
Don't ask me about the specifics because I totally lost all my
yeah,
my ventilator skills. But I still work in a chronic vent, and right now we use the Respironics trilogy
trilogy.
for our clients here.
Yeah, a lot of people did work on the acute side of the hospital. They gotta have to learn how to use those chronic ventilators, and
Exactly.
those
Yeah.
are quite challenging for some who are not used to it.
Hmm.
Yep. So I think we're almost done here with the questions here. Now, what is
Does
your?
your does
Mhm.
sorry? Does the audience have questions before I start? Or
If you have any questions at any point to our audience, please type them in on our YouTube channel, on the chat box. Type them in, and we will answer those questions.
yeah.
Um, If we don't get it now, hopefully we get it now. If not, we will answer that
Yeah.
later on
If
the
they
show.
have questions about how to practice here in Canada, I will try my very best. But again, as I said, different jurisdiction, different province has their own
Mm-hmm.
rules. But I can probably redirect you to the proper person that can talk
Mm-hmm.
about it.
Mm-hmm.
And I feel like same provinces has the same like requirements anyway. So
Mm-hmm. Well,
yeah.
so yeah, that's a good question. So, if this is, when I was in the Philippines, was fortunate to be invited to the ARCPP International Congress in Manila. That's one of the questions that they were asking with our CSRT folks, Dr. West and Carolyn McCoy, when they were there. Same question they go, for the United States. How can one practice respiratory therapist if you're a graduate from, say, Philippines? Just a brief, and then you can just redirect us where, for more information.
So as I said, different province has their own jurisdiction.
Mm-hmm.
But if you contact CSRT, I'm pretty sure they would love to. Like, they definitely will entertain you.
Yeah.
It's just a matter of aligning your experience and your education with the Canadian education, which is sometimes people think it's really scary, or sometimes people is already like losing hope that they'll be able to qualify here. It's just a matter of timing, and it's just you just maybe need to have some refresher course, or
Mm-hmm.
maybe just need extra training.
Mm-hmm.
But with work experience in school, it actually sometimes or the person that you will talk about that will definitely help you every step of the way. So I can only give you an idea
Mm-hmm.
in Alberta. So for Alberta, there's actually a link specifically for foreign trained RRTs. So if you go to the CARDA website, and then I believe you go to member registry, there'll be a link there for foreign trained
Mm-hmm.
RRTs, and then it has all the informations that you need. I know it can be costly because you're paying like Canadian dollars, but like it's really worth it to try. And I even encourage everyone, especially in the Philippines, to try. I mean, like, there's no harm in trying, and they'll definitely give you answers for the questions that you need.
Yeah. Good thing that you mentioned that, contact the CSRT and they will entertain you. And, I could attest to that because when we were in the Philippines, that CSRT, and I think people know because every RTRPs in the Philippines are members of the ARCPP, and they are aware that there are, I cannot disclose much because I don't know much, but they signed a memorandum of agreement between the ARCPP, which is the Association of Respiratory Care Professionals Philippines Incorporated, the CSRT side in the Philippines, or AARC in the Philippines, and the Canadian Society of Respiratory Therapists, and the representatives that attended there, they are well aware of how the respiratory therapy education is in the Philippines, and how is it translated per se to the Canadian side of it. So yeah,
Yeah,
reach
and
out to
I
CS.
can attest to that
Mm,
because the CSRT, I believe a couple of years ago, released a position statement that yeah, they actually is really proud that they built partnership with the Philippine
right.
counterpart of the CSRT.
Mm,
They're very proud of that, so which is good. In fact, like, I'm pretty sure in the CSRT conference in May, there's one Filipino RT that will actually present, and I'm actually looking forward to actually watch his presentation.
yeah.
Good thing that our presentation is not the same time as his presentation, so that's for sure that I can attend his, and then attend mine after that.
Yep, yep. And once the CSRT release their full agenda, then we can disclose whoever that person is. But yeah, can't wait for the CSRT annual convention, which is gonna be virtual this year, and we're
Mm.
gonna tune in for that and get more information as more information is available for that. Um, for that particular event. And now, next question I have, or one ask I have is, what is your message to our current respiratory therapist amidst the COVID-19 pandemic and everything that we're going through now? So just parting words before we move on to your presentation.
Um, my words is don't give up.
Mm,
I know it's saddening that we got our professions or our the respiratory therapy profession got the spotlight in an unfortunate event, which is COVID-19. So it's not really the best way to get the spotlight, but I mean the pandemic is here now. We need to address it head on, and people are relying to our expertise. So I salute everyone all around the world in terms of respiratory therapists. And then I guess the fact that we're getting valued now and getting the vaccine as a COVID-19 vaccine, and we're part of the priority lane, that means that we actually move forward in terms of advocating and promoting our professions, which is actually really, really good.
mm-hmm.
I guess it's just like we just have to accept this somber reality that the pandemic, the COVID-19 is here, and people are relying to us. The other healthcare professionals are relying to us. And I'm just saying, proudly to say that I'm really proud to be a respiratory therapist at this current environment. And I would say I appreciate everyone, every RTs all around the world.
All right, thank you for that. And the last one is, what is your message to our future respiratory therapist? You know,
Oh, didn't they just write their board exam like the one in the
yeah,
Philippines? So
they did.
congrats to whoever who
Mm-hmm,
passed, and to ones that didn't pass.
mm-hmm,
You guys will have your time definitely the next time.
mm-hmm.
Um, I'm just gonna say, everything is achievable. Don't just limit yourself for something that you're in your comfort zone.
Mm-hmm.
Go outside your comfort zone. Think outside the box. Always be proud of who you are and what you are. Anywhere in the world, we already have the Filipino brand, so I mean, like, people were already respected in terms of the healthcare profession, because it's just like our healthcare expertise and the quality of care that we give to our patients is already embedded to other nation,
Right.
and we already got respect in terms of the healthcare industry.
Mm-hmm. Good, good, good. Thank you for that message. And we are going to pause for a short, like a brief break before we go to your presentation. Then after presentation, we can have more time to chat and do continue the
Okay.
show. So let me just transition my. All right, we'll be right back. All right, and you can. There you go.
Do you want me to end call?
No, just prepare your presentation.
How
They
do
can hear
I
us.
present it? Oh, sorry.
Yeah, they can hear us. It's okay. Present now.
Okay. And then my entire screen.
It's
I'm not familiar with this.
Google Meet. Yeah,
Yeah,
depends on what you're
I'm
gonna
more
use.
on Zoom.
If you're gonna use it's a PowerPoint, right?
Yeah.
Yeah, you can just share your entire screen
Okay.
or a window. I think a window or a tab is for online, stuff. They can see it right now, so you can play.
Okay.
Yeah.
Um,
Then for our audience, we are just preparing for Mr. Leonard to start his presentation. MDI with spacer versus nebulizer. With this current situation we're in right now, people that have recovered from COVID or people that are having COPD, asthma, or whatever breathing disorder that you have, and you are currently using an MDI or a nebulizer. This is a good topic for
okay.
you guys.
I really need your help here. I,
Mm-hmm.
I, I don't know how to share.
Yeah. Uh, So present now in your entire screen.
Okay. And then it just gives me Chrome wants to share the contents of your screen. Choose what you like to share.
Oh
But
yeah.
there's no option.
Is your PowerPoint open?
Um, yeah, it's open.
Mm-hmm.
But how would you share this?
Let me see if I have a PowerPoint open here.
I can send it to you. Oh, but I have to
Yeah, go ahead. Yeah, send
control the tab.
present
Just a
now.
sec.
A window, not a window. A tab. Present. So you can do a present your entire screen and just give that. Yeah, you can just say share, but make sure that you're sharing the one that has the PowerPoint.
Oh,
And
there you go.
I don't think you'll be able to see yourself. But yeah.
Okay, just a sec here. I think I need to change my system preference. This is embarrassing. I'm so sorry.
No, 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 no. It's a Google Meet. We don't have the budget for Zoom for a longer
Okay.
conference. That's fine. While you're doing that and preparing for that, so we'd like to um, congratulate all our newly registered respiratory therapists in the Republic of the Philippines, RTRPs, and all the top notchers from different schools. And later on, I will mention each and every one, but the top notchers belong to Universidad de Zamboanga, Pine City College, Emilio Aguinaldo College, Manila, University of Perpetual Help System in Laguna, and Cagayan State University, Lorma Colleges, again, University of Perpetual Help System in Dalta, Las Piñas, and then Mary Child's College, formerly General Hospital School of Nursing and Midwifery, and Far Eastern University Nicanor Reyes Medical Foundation, or NENRMF, in I believe in Novaliches, Quezon City. So congratulations to all of you, and we can't wait for you guys to join us and you know perform respiratory care, which is a wonderful thing. You doing okay?
I'll probably just send you
Yeah.
my topic, but I don't know if it's the PowerPoint. Just a sec here.
Um,
Okay, I send it in your
email.
email. The one that you gave me the link. Oh
Yeah.
yeah, it worked.
Oh yeah.
So if you would just open that, then
Yeah. Let's see here.
and once while you're opening that, I'll be right back.
Yeah. Yeah. We'll be right back. We're just getting our presentation here open up for all of you.
Okay. Did
Um,
you?
Let me actually a tab. I'm opening it through Google Slides. Here.
Perfect.
Can you see it?
Yeah, and then you can just put um, on presentation.
Oh, there's gonna be a problem here on my end. If I do percent, they're not gonna be able to see. So, are you using Google Slide, right? Go back to your email.
Yeah.
Mm-hmm. Go to send and just click on uh the attachment that you send me,
Okay.
and then do you have it open?
Yeah.
So
It's right now.
go percent now, and then use a tab. Like, yep, click the tab, a tab,
Okay, just a
and then just select the tab that has your presentation in.
Oh, okay, got it. Just a sec.
Yeah.
No, it's not working.
It's not working. Let me try again on my end. Tab, share.
But what I can do is this, though. Just a sec. Can you see it now?
Oh yeah. Wait. Yeah.
And then I'll do this.
Perfect. Yeah. There you go.
Okay, it's working.
Yeah.
Okay, and then I won't see you guys, but at least you guys are seeing my slides.
Yeah. Yeah.
You guys are ready?
Hold on one second here.
It's gonna be a quick presentation. I think by 25 minutes we should be done.
Mhm. There you go. All right. Welcome back. Sorry for the delay, but we got our presentation up on the screen right now, and we are about to present, or Mr. Leonard is about to present his presentation here. So sorry if those our audience who are following us or watching us live now. If you can, invite your your colleagues again or your friends watching with you. We are now gonna be presenting soon. So, Mr. Leonard, take it away, please.
Okay. So good morning or good afternoon to everyone, and good evening to whoever watch in the states. For Middle East and Philippines, good afternoon. So my topic for today is MDIs with spacers versus nebulizers. If, as you notice on the left hand side, it says October 3rd, 2017. I actually intentionally didn't change that because I just want to feel like some sort of like time travel back in 2017, wherein we didn't anticipate this global pandemic. I'm actually just doing this nebulizer presentation just to kind of like help out our site not to use so much nebulizers because of incidents of actually other aerosol issues such as influenza or pneumonia. And then the biggest threat before was SARS. So it was actually just a big talk regarding this. So I intentionally did the 2017, and I probably add some COVID-19 slides in here, but it's fascinating that I did this before the global pandemic, and now it's actually a big thing now here in Canada. We don't use much nebulizer to prevent the transmission of the infection. And also, just a disclaimer: I'm not here as an adversary and tell you guys not to use nebulizer. It's up to you if the preferred choice is still a nebulizer. But I'm just stating the facts and I'm just stating some information. So for disclosure, there's no financial disclosure or conflict of interest to declare. I don't have any sponsorship or anything. So these are the examples of current respiratory devices that we have out there right now. As I said, Canada is different than the Philippines. This probably is a Canadian brand puffers, and then it'll probably be different for the Philippines. My lolo in Batangas has COPD, and I'm quite sure that the naming and the branding is different compared to the ones that we have here in Canada. But these are just example of the respiratory medications out there. I added this because I wanted to compare the four healthcare systems. So the Canadian, the Philippines, the American healthcare system, and then the Middle East healthcare system. Um, the thing about this slide is I want to tell you guys that if it works for Canada, it might not work for the States, or it might not work for the Philippines, in a sense that we have different healthcare systems. There's different factors that will play to say that, yes, we still need to use the nebulizers in the Philippines compared to Canada, because, you know, Canada is a public healthcare system. So the government pretty much pays for everything. Unlike in the Philippines, there's a mixture of private and public. And then American is the same thing. In the Middle East, I'm not quite familiar how your healthcare system works. So again, one might work in this country, but not on the other places. So this YouTube video, it's gonna be long, but it's just an asthma scenario in the show house. So wherein the lead is teaching this client how to use her puffers because she's not doing it properly. I'm pretty sure you guys are familiar with this scene from the show house. So I just want to remind you or refresh you with the epidemiological triangle. So the acquisition and transmission of infection. I just want you to familiarize yourself with the top three triangle. So that's the infectious agent and source, so COVID-19, environment, which is the external factors, and the susceptible host, which is healthcare workers and patients. So it's pretty much each factors can contribute with the transmission of a disease or infection. Yeah, I'm scrolling it. Which slides are you guys here? Yeah. What? Oh no. Okay. Oh no, it's good. Sorry about that. Then I'll just gonna use the Gmail then. Is it moving now? Okay, good. Is that okay though in terms of like size? Okay, all right. So these are the slides that I said for the Canadian, Philippine, and American Middle East. This is the link for that scene in house. And then this is the last slide. My apologies. So the infectious agent source, so the COVID-19, environment, external factors, susceptible hosts, healthcare workers, and patients. So meaning each one of them can contribute to the transmission of disease. So it's a vicious cycle. If we're not doing good in terms of one factor, it might affect the transmission, if you know what I'm saying. So it's a chain. It's a chain reaction. Okay, then we're gonna have issues with this then. So why nebulizers is such a big thing for patient and staff? I know there's an error here with the slides. It's easy to use, less inspiratory effort needed. The other thing is, I guess it will also work for the Philippine healthcare system. The cost, because it's of course cheaper than the regular MDIs. But the main important part when I'm asking patients and staff is the visible aerosol or mist particles. So therefore placebo. So they're actually seeing the aerosol itself. So in their head, they know that there's a medication that is coming into their lungs, meaning aside from the treatment itself, the placebo will help for them to relieve that symptoms. If you kind of know what I'm kind of explaining here, unlike if you use a dry powder inhaler or an MDI, then they won't have that mist particles that they could see from their from the medication. Okay, now we're gonna have definitely issues with this one. So let me try here. Sorry, guys. I'm not really familiar with this technology that we are using. So
Yeah, no worries. Try clicking present again and try to see how you can present your actual slides.
okay,
Um, I think you're just gonna have to click the your entire screen when you present. It's a
yeah,
little bit
I
better.
know.
Oh, here we go.
Okay, okay. Now you can see all my screen.
Stop. There we go. We can see it now.
Okay,
All right. There we go. Perfect.
okay. Sorry about that. Okay, so easy to use, less inspiratory effort needed, less patient coordination needed because it's a mist. So if they're unconscious or not, there's a mist coming out of the aerosol mask. The cost, it's cheaper, and the biggest thing is placebo, visible airable mist particles. Therefore, they could see it. So, what are the risks of nebulization? So, nebulizers with a reservoir can allow growth of hydrophilic bacteria that can then be nebulized during these devices. And the current nebulizer contamination is us, healthcare workers, especially if we're not washing our hands properly, not wearing the proper PPE. Patients itself, non-sterile fluids for both rinsing the device, because we sometimes keep a nebulizer for a week or so, or even the sterile fluids that we're not using on the patient. True story, there's patients that use, instead of saline, they use tap water to nebulize for cold humidity. There's also the inadequate sterilization or disinfection between uses, because they're trying to be cheap and save a lot of nebulizers, so they don't replace it much, but they forget to sterilize or disinfect it on a regular basis. There's a lot of bacteria that can multiply in those nebulizer fluids if we don't regularly clean them, such gram-negative bacilli as you see. There's Pseudomonas, Flavobacterium, Legionella, Stenotrophomonas, and non-tuberculosis mycobacteria. So aerosol particles in the therapeutic range is a ready vehicle for bacterial contamination, just the right size to carry the disease. So imagine if we're using aerosols and we're not properly wearing PPE. Case scenario, we're using an aerosol for a COPD client that still awaiting a COVID-19 swab results, and we didn't wear the proper PPE, and then all of a sudden the results came back positive, then boom, that's a big issue, safety risk for healthcare professionals like us. This contaminated aerosols are associated with an increased risk of patient acquiring pneumonia. As I said, I'm going back travel time here, just like Back to the Future, 2017. We're only worried about pneumonia. We're only worried about seasonal influenza or SARS or TB. But now we're actually dealing with, I would say, the most villain of them all. It's like the Thanos of the Marvel cinematics. So nebulization is an AGMP, stands for aerosol generating medical procedure. So an AGMP, as you know, is any procedure carried out on a patient that produce aerosol or droplet size particles. So the tiny particles that we see in the airborne transmission, that we call that a droplet nuclei. And then again, if healthcare workers are not wearing proper PPEs, not wearing a 95, we can inhale those droplets because it's a bigger particles than any other um, particles out there, especially in wards wherein there's the ratio of, let's say, 10 people into one room. Then that's a big issue for mass transmission. What are the other risks? The risk of infection transmission in aerosols may increase. There's a potential to generate a higher volume of respiratory aerosols. Again, the aerosols can also propelled over longer distance than a natural cough or sneeze. So that can be, you can say that could be a bit of an airborne, especially if there's like electric fans out in the room. Easy to transmit that aerosol infected particles. Tuberculosis and SARS are infections that have demonstrated a risk of airborne transmission during this AGMP. And then, as we know, COVID-19. The impact of AGMP in the transmission is still unknown for pandemic influenza. So again, going back to the future, we're only anticipating a pandemic influenza virus back in 2017, and now 3 years after, it's actually happening. So it's fascinating how in that short span we're dealing with a way worse issues than TB or SARS. Again, I'm not an adversary here. If nebulizer must be used, especially for other countries that is still using nebulizers, just make sure that there's a closed aerosol delivery system with the reservoir. And this is a big issue. They're recommending a viral filter. But the thing though is viral filters are actually quite expensive. For once that you attach in nebulizers. So you're actually defeating the purpose of saving money from using nebulizers. So we now jump to the fact that staff just need to wear a proper PPE and a proper N95 mask when they're using an aerosol generating procedure. You know, just to save yourself, to make sure that you're not carrying the disease outside the client's room or bringing it at home. Wear a proper PPE or N95 if you really have to use AGMP procedures such as nebulizers. Okay, what are the other drawbacks for nebulization? It's time consuming for patients because sometimes it takes a while before the medication is actually done. It usually takes from 10 to 15 minutes. So staff actually leaves the room and then come back, and we don't know if they actually took the drugs or it's just maybe they went to the washroom, they removed it, and then they came back. They didn't get the full dose. It's unable to verify patient actually received the medication, as I said from the examples that I gave, because you guys have to deal with other clients and you guys left the room, then you won't see them actually receiving it. There's also the unpredictable output and particle size of the medication, especially it's dependent with the patient's breathing pattern. So if we have an unconscious patient in emerge and we're using aerosols, there's not really much medication that actually deposits in the lungs. As we know, aerosol medication, there's only 20% of the medication that actually deposits in the lungs. So the question is with the breathing pattern, if they can't take a deeper breath, maybe they have some pneumothorax or let's say a pulmonary edema, and that hinders them to take a deeper breaths, then that's going to be an issue. Flow meter settings, especially in my case wherein I'm the sole RT, I have to train them that you have to make sure that the flow meter is set at 8. Sometimes they set at 10, sometimes they set at 4. So that affects the output and the particle size. Change throughout the treatment as volume in nebulizer decreases. Deposition, because if they're wearing a mask or a mouthpiece, if they have a mouthpiece, of course, that means you can't use that for people with neuromuscular disorder like quadriplegia or paraplegia because they don't have the limb function unless they have a caregiver that can hold the mouthpiece, the tube. So mask will work, but then again, it depends on the delivery method. The optimum position is upright, but then again, for people who's unconscious, let's say having asthma attacks or COPD attacks, sometimes they're supine, so that can also hinder and affect the output and delivery of the medication. Now we're going to the benefits of the MDI with spacer. As I said, different healthcare systems is different. So the MDI with spacer works for Canada because it's actually the same, like because the clients doesn't pay for nebulizers and sometimes the client doesn't pay medication when they're in the hospital. So the hospital actually saves up money when they use the MDI with spacers because aside from using nebules and the nebulizer and the masks, the disposables, they're also not using a lot of oxygen or air source. Because here in some rural areas, there's no built-in air flow meter. It's all oxygen flow meters. So they're actually like wasting a lot of oxygen source, especially with COVID-19. There was actually an issue before in Calgary wherein they almost ran out of oxygen supply in one hospital. So in the long run, it's actually, the hospital is actually not saving up with the nebulizers, but with the MDI with spacers, it actually works because after they're done with their stint in the hospital, they can actually bring that home and they can use that until it gets empty. So the good thing about the MDI with spacers is also good for all age group, and a mask can be used in conjunction with the spacer. So there's a bunch of spacer. There's a spacer with the mouthpiece. There's a spacer with the mask for pediatrics, and there's also a spacer with the mask for our older folks, for older generation that has cognition issues. So this is actually good for all age range. This is a graph or a picture that I actually like to use for client education. It's crucial that we use a spacer when we're using an MDI. If we put the spacer directly to our mouth, just bear in mind it runs 60 miles per hour. So I know in the States you guys use the English measurement. So it's 60 miles. So if we use it, if we convert it into metric system, that would be around 90 to 100 kilometers per hour. So it's like driving in a major highway here. So you're not also getting much medication in your lungs. But if you have a spacer, I think you get a deposition rate of almost like 80 to 90%. So it's really crucial that if you use this MDI, they use it with spacer. If it's too cumbersome for your purse or for your bag, and then you have to use the MDI, make sure that you have a 2-finger distance from the MDI and to your mouth, and that will help the trick. Or if you have empty toilet paper rolls, MacGyver something, that will also help. What are the benefits? Particle size is in desirable range. Patient able to inhale medication even at low flow rates. So for clients that couldn't take a nice deep breath in, they could just take 5 smaller breaths, and that's the same thing. It's a one-way valve, so when you exhale, it doesn't go inside the spacer, it actually goes to the exhalation port. Most respiratory medications is available in this form. I know a big common nebulizer treatment is Compivent. If we have a Ventolin and an Atrovent, that's Compivent right there. It's faster treatment time because you actually give the medication and it only takes a minute or two. And caregiver can ensure medication is given to the patient because you're actually there beside the client giving the medication. It's not like you start the aerosol and then you leave. So you don't know what's gonna happen in that time span that you guys are gone. So there was a Cochrane review in 2013 about comparing MDIs and spacers to nebulizers. So the question though was when someone is having an asthma attack, is it as safe and effective to use a spacer instead of a nebulizer? So this Cochrane review in 2013, they found the quality of the research moderate. They did 39 clinical trials involving 1,897 children and 729 adults, and 33 of the trials were conducted in an ER, general practitioner, so clinic, GP surgery, and the community setting. And 6 trials were on inpatient with acute asthma. So this is what they found in that Cochrane review. Taking beta agonists through either a spacer or a nebulizer in the emergency department did not make a difference to the number of adults being admitted to the hospital. Whilst in children, we can be fairly confident that nebulizers are not better than spacers at preventing admission. But lung function tests were also similar for the 2 delivery methods in both adults and children. Pulse rate was actually lower in children taking beta agonists through a spacer, and there was a lower risk of developing tremors. So these are the answers that they got from that Cochrane review, and it showed. Sorry, yes. And then the Canadian Asthma Consensus Guidelines state that the MDI with spacer has been shown to be at least as effective or superior to wet nebulization in all age groups at all levels of severity. Okay, what are the drawbacks for using the MDI and spacer? And again, increased staff time initially because you have to teach someone how to use the medication properly. Change is a very difficult way, especially in long-term practices. If we already have an RT or nursing that use aerosol for like most of their career, maybe for like 25 to 30 years, it's going to be hard for them to have this change overnight. And having said that, more patient and staff education then required to do it properly. Because, one issue is the technique. Some nurses, some RTs, if the doctor says 2 puffs, they just puff. They don't even shake in between. So it's going to be a lot of education for this population. Proper technique is very important also to ensure the delivery. So we have to make sure that the healthcare professionals are familiar and trained how to use this MDI and spacer. And then again, I added the cost last minute because again, different healthcare system is different. So Canada will vary to the Philippines. It varies on different countries because cost will be an issue, especially if it's not a public healthcare system. I guess as an RT, because this presentation is meant for the general healthcare population, we're familiar how to use MDIs. I won't talk much about this. Of course, we have to shake it, attach the MDI to spacer, spray 1 puff into the spacer, and voila, they could either take a big breath in and hold for 10 seconds, or they can actually take 5 smaller breath ins, and that's the same thing. Some air chambers, they have a whistle. So if it whistles, that means they're breathing too fast. So you can tell them to slow down. If more than 1 puff is prescribed, wait at least 30 seconds between spray, or shake it at least 10 to 12 seconds. MDI canister needs time to recharge between puffs, and 50% drop in deposition if sprays given in succession. So that puff. So we're not really giving the 100% on the second one because we're mostly giving them the propellants. This is actually the trick that I do, especially with my clientele and with my chronic vent patients. You can actually interchange the puffs between. So if you have a client that needs a combi vent, then of course you need to give them 2 puffs of Ventolin, 2 puffs of Atrovent. You give them the salbutamol first, and then you switch the salbutamol, or it's even better if they actually have two spacers attached to the salbutamol and Atrovent or Ventolin. So when you give the puff of Ventolin, then take the puff of the Atrovent. By the time that he's done taking the Atrovent, you already recharge the Ventolin. So you can actually give the Ventolin on the second puff and then the Atrovent. So that will actually cut your time in half. So that's actually my trick that I still do in the community in my practice as well. So I sort of told you guys about this. If patient unable to use single breath method, use the tidal breathing techniques. So shake and depress canister into the spacer. Have the patient breathe in out through the spacer, because as I said, it's a one-way valve, so it doesn't go inside the chamber. It actually just exhale through outside the air chamber. They recommend 8 to 10 breaths for children less than 18 months and 5 to 6 breaths for a patient more than 18 months, so 2 years and older. And it's beneficial to have an air chamber with the mask for pediatrics. Okay, so spacer with masks are available for all age groups, especially with our geriatric population that has the cognition and coordination issues. It must be used though it must be used for pediatrics less than 4 years old, or any person who's unable to seal their lips around the mouthpiece. So that's for the mouthpiece. Orange is for infants, yellow is for 18 months, and blue is for larger children and adults. I think that's the universal color, but I don't know if that depends on the brand. But upon noticing, different brands actually follow that certain color for age range. And it's really important to get a good mask seal on the face to ensure medication delivery. One-way valve in spacer allow patient to exhale into room. As I said, it's a one-way valve, so when they blow out, it doesn't go inside and mix in the medication. It actually just go in the atmosphere. And use the tidal breathing technique if they have issues with the deeper breaths. So for our pediatric considerations, which you can correct me if I'm wrong, because I totally lost all my pediatric work experiences. I just concentrated on the geriatric population for my whole entire career. But in infants, apparently, drug delivery to lungs decrease by 2/3 if they're crying. But there's no drug deposition in awake or sleeping children. So having said that, it's good to give the medication after they cry, or maybe if they're sleeping. Mask leaks also greatly decrease medication deposition, so the right size spacer, and children ought to scale inhaled medication. So smaller doses are not really necessary. That's as per the 2003 Canadian Pediatric Asthma Guidelines. Other considerations, as I said, we're not living in a perfect world. Everyone will still we'll still use a nebulizer. We just have to make sure that we protect ourselves, so PPE and N95. But there's also medications that is not available in MDI or dry powder form. So EPIs and Mucomis are still familiar with cystic fibrosis and people with thick secretions. It's not available in dry powder, so I guess we still have to use the MDI for this one. There's also studies before that for palliative for people that is nearly dying and on palliative comfort care, they actually did nebulize some opiates for relief, such as morphine and hydromorphs and such. But there's no evidence that can support that. I asked our palliative care nurse about that, and the palliative nursing practice lead about the nebulized opiates, and they said there's no evidence to support that, and it's not the best practice. It's also not a big practice, especially if there's a bedside RT also inhaling those nebulized opiates, and by the end of their shift, they're all like high and, they're all like loopy and such. The only other instance when a neb should be used is if a physician writes no substitution. I would argue with this one. If it says no substitution as an RT, I feel like we now work in an interprofessional collaborative way. I feel that every part of healthcare or every member of the healthcare professional team is valuable, and it's not I'm away of the doctors, the captain of the ship, and they all do the directions. I still like to brainstorm with our docs. So whenever they say no substitution, I do actually my own self-assessment to see if the client can actually tolerate using the MDIs with spacer. So let's say there's actually I have one client wherein he lives on a farm. He's a farmer. He accidentally got stumped by his horse on his face. So the face was totally gone. They have to do an emergency tracheostomy. So there's actually no mouth, no nose. So I guess the nebulizer will work on those certain situations. But then again, the self assessment is really, really valuable on these certain scenarios. And I think that's it. So any questions from the audience? So this is my reference. So you guys won't be able to sue me for plagiarism, but this is my reference. Any questions?
All right. We do in our YouTube chat. We do have a question from can't read, but it says it's Chowi E. He's from Lung Center of the Philippines in Quezon
Oh
City.
wow!
Yeah, shout
I
out.
I I watch. I still watch Filipino shows like TV Patrol, and I salute you guys. I heard there's a surge out there, so stay safe, guys.
Yep. So the question is it right to advise the patient wearing aerosol mask to breathe in from their mouth, exhale through their nose, since we are meant to achieve the 10% that takes place into the lungs?
Oh, so they still use the aerosols and such.
Yes.
So they want to inhale from the mouth and then through the nose.
Yeah, so in into the mouth, out through the
Oh, that's
nose.
fascinating. Well, the thing is, you can try them, but I would say it's gonna be doomed to fail because um, you can teach someone to do that, but they won't be able to do that for the next 15 minutes or so. They're not going to be able to coordinate that for the whole treatment itself, especially if they're on some sort of like drugs or pain meds
Hmm.
to begin with. You can try to advise them to do that, but I would say they won't be able to do that. But
Yeah,
you can try.
yeah. Uh, Good question. Thank you for that question. But yeah, it's
And
good.
then here's also what I'm thinking. If they're already having COPD and asthma attacks to begin with, we're actually reversing the pursed lip breathing on that situation. So if they take a breath into their mouth, so they're getting more air and they're already hyperinflated to begin with, and then you ask them to breathe out to their nose, they're not going to get so much air out. Unlike, so the pursed lip breathing that we recommend is into your nose and then out to your mouth through pursed lip. So we're actually cheating the exhalation time. We actually want the exhalation time to be doubled than the inspiration time. So it's going to be uncomfortable for the patient, I would say, especially if they're already having hyperinflation, chest
Mhm.
tightness, to take a big breath in on their mouth and then onto their nose. Yeah, it's going to be tough, I would say, for the client.
Right. Yeah. Yeah. Good to know. Thank you for answering that question. Do we have any more questions from our audience? So it's good to know. I know. Well, first of all, I would like to. We're gonna wait for question here, Mr. Leonard. But yeah, shout out to our Mr. Choey and our frontliners at Lung Center of the Philippines, and everyone who's watching. And also shout out to our Pine City College students, and their program head is watching with us
Oh, wow.
live now. Yeah. So
Hello.
yeah, we have some students here. So this is thank you for supporting us, and I know that your presentation, Mr. Leonard, is very interesting, most especially to our students.
Yeah.
So yeah, they're currently watching you and learning from you, and
And
some
just so
people.
you know, guys,
Mhm.
I also ask questions on outside the presentation. If you just have questions about the role of RRTs here in Canada compared to the Philippines, I can answer that too. Licensing, I'll try my best.
Mhm.
But yeah,
Yeah, good. So, any more questions from our audience? If I may add to that question, yeah, normally, if you would instruct a patient to using a nebulizer, right? So, if you're instructing a patient using a nebulizer, you would technically you the proper way, or I wouldn't say, but the textbook recommendation per se for that is, have them try to do normal breathing through their mouth so they could absorb the treatment. And then have them do a 5 to 10 second pause every so often. But as Mr. Leonard mentioned, that if your patient is having, acute exacerbation of whatever disease they have, then they couldn't do it. I think the key to that is, practical bedside recommendation would be, as long as your patient is breathing normally and they're absorbing the treatment, that's what's important for our patients, especially using nebulizer. And as
hmm
mentioned earlier, the nebulizer is cheaper, but then again, some countries have, and depending on insurance purposes too. But for you guys in Canada, it's a socialized medicine, so that's good. You don't have to worry about much of cost. But for like Philippines, they're a nebulizer. We know that it's very costly, and so people would choose, or hospitals would choose nebulizers or nebules to be administered. But then again, having
yeah.
those protection is very important. Coaching your patient to get the medication right is the key, so they can get their medication, or you would increase the efficacy of the medication you are giving.
I actually have a question with our lung center RTs. Maybe you can ask my question. I'm actually really curious. Here, for aerosol mask or aerosol nebulization, we actually hook the tubing to the flow meter. So we set it at 8 and then it produces a mist. In the Philippines, are you guys still using more of the compressors, like the compressor nebulizer? Because I still remember when I was a kid, I have asthmatic cousins, and they always bring those compressor nebulizers with them. So, do you use more compressors than the flow meters?
All right, we will wait for your answer, sir. So just type in on the chat box. Um, what's the answer? So are you
Yes, I
are
need
you
help.
right? Are you hooking it up on the oxygen tank or medical gas air, or are you guys using the pomoade or the compressors?
Yeah, because the
They
compressors are still available in the drugstores here.
Oh yeah, that's what
I
they
actually,
home care, right? Home
yeah,
yeah, DMEs.
yeah.
They actually bring deliver those compressors for our patients. If we don't get the answer, I may know the answer, but we'll wait. We'll give
Yeah.
Mr. Choi a chance to educate us. But if you guys have any more questions, please feel free to type it on our YouTube chat box or PM me on Facebook, as because some you need an account to put a comment in here. But if you can just let us know with any of your questions. But a good presentation, Mr. Leonard. Thank you for
Thank
educating
you.
us with the difference or of getting an MDI with a spacer versus a nebulizer. And good thing I would point out on your presentation is that's a good study that they have done, that there's not much difference in hospital admission if you are using MDI with inhaler versus nebulizer on children, correct? I mean, according to the study that you present.
Sorry, I didn't get your question.
So the study that you have presented, there's not much of a difference with hospital admission for
No.
kids, right? Using an
hmm
inhaler with spacer versus nebulization.
Exactly. So, I mean, even though they're the same, then that means we have room for change. Like, I mean, we can still break the cycle of using the nebulizer and use an MDI, and it's not going to affect with the hospital admission rates.
Mm-hmm.
So that's I think the general message on that.
Right. Good. Good. Thank you.
Yeah.
And also, proper instructions on how to use the MDIs and our DPIs and our regular nebulizer is very important, because if you don't give it correctly, or you don't teach them correctly, the education part is very important. Then you are not giving the appropriate medication dosage to your patient, and it would be basically useless. So
Exactly.
yep. All right. We didn't get a response from Mr. Chewy, but yes, I believe when I did shadow, shout out to Philippine Heart Center and St. Luke's Global City, in Global City and Philippine Heart Center in Manila. Yeah. The pulmoade or your compressors are still widely available.
Oh, okay.
Right. Yes. You
Okay.
so you
Got
still
it.
carry your nebules with you. You'll have your compressor with you, and then you'll nebulize through there. It's not only it's cost
Mm,
effective, but it still works.
exactly. Okay.
Yeah.
Yeah.
Um.
Well, do you want to proceed with the 5,000 pesos
Ooh. Right. Yes.
question? So how are we gonna get the answers though? That's the thing. If they don't have an account, then there's no direct message.
Right. This is what we're gonna do. We should have thought about this before doing the actual show. We could have invited them on our show. But yeah, what we can do is, if you're participating to our Q&A quiz B sputum bowl thing, um, um, type your answers in the chat box, and we will make a tally from there. Um, so if you could prepare, would that work?
Is there a chat box in here?
And YouTube, on YouTube.
Okay. Well, you said if they don't have an account, then they can put the answer.
Right.
So how about here's my suggestion, Michael. How
Mhm.
about whoever's faster, give the answer to either to Michael's Facebook Messenger.
Right. That would work too. So either YouTube
Yeah.
or my messenger. You can um, let
So find Michael de Peralta on the party, and just even though you're not friends with him, he would be able to see your messages because I prepared um, questions. So whoever just gets the highest point, I guess, wins the first prize. And then Michael, you said there's a second and third.
Right. Yeah. So here's what we're gonna do. So add me on Facebook. If not, message on our ang RTMO Facebook page. Follow and like, and you can send a message through there, and can see that instantly. Or put your answers on the comment section on YouTube.
Okay, you
So
guys are ready.
right.
Oh, and then for sending, I guess they have to add me for the info
Oh
so I
yeah,
could
yeah.
send it to them.
Right.
All right, you guys are ready.
All right. Here we go.
First question: true or false? There is no evidence to support the use of nebulized opiates for relief of dyspnea in palliative patients. Is it true or false? All right, Michael, wait for some response here.
Okay. Can you repeat the question one more time?
There is no evidence to support the use of nebulized opiates for relief of dyspnea in palliative patients. True or false?
All right. We don't have any response yet.
No?
No, I think that's the challenge of it. But we'll see if somebody will answer the next question. All right.
Oh, I hear some answers.
Oh, true.
And that's from?
Rebelus Mangapak or Rebelus Mangapak.
There you go. Yeah, that is correct.
Oh, you got 1 point,
Okay, so
sir.
1 point.
Yeah,
Okay.
sir, ma'am. Sorry.
Yeah, yeah, write it down and then we'll chit chat later.
Okay. Next question.
Next question. What is my age? Is it 27, 31, 33, or 39?
He's really making sure you're paying attention to this.
No. Yeah.
27, 29, 31, or 39?
No, 27,
Oh,
31, 33, or 39.
27, 31, or 39. All right. Type it in or send a message to Ang Artimo Facebook page or my personal Facebook page.
Yeah, well, Revolus is leading so far, so she might win.
Yeah, just your best guess. If you have missed it earlier, just best guess. I don't think.
Yeah,
Yeah,
yeah, it's not right minus wrong, so you should be okay. You still have 1 point if you.
we got an answer. Anyone else? We got an answer from Rebelus again. His very kind answer.
What's her answer?
It's gonna humble you. Answer is 27.
Oh no, it's not 27. Any takers?
All right, we got a second one. Gemly Malado, 31.
Okay, 31 is correct.
Awesome. Ooh, we got one.
Okay, so Gemaline and Revolus is now on both leads.
Yep.
Okay, who's gonna win the 5,000 pesos? Next one. Aside from COVID-19, provide example of a lung disease due to airborne transmission that I stated on my presentation. Aside from COVID-19, provide example of a lung disease due to airborne transmission um, that was mentioned in my presentation. Go.
All right. Let's see. Besides COVID-19, what other lung disease that was mentioned? What airborne disease was mentioned on Mr. Leonard's presentation? Right, we're waiting. Rebellis, Gemly, Karen. You could. Karen is giving us a hand clap. I try to answer.
Try
You
to
might
answer,
win. You
Karen.
might win.
You don't want to lose the opportunity.
Right. And then while we're waiting for an answer here, from Miss Rina Liza Bogsulen from Baguio City. Thank you, Sir Leonard, for the knowledge and Canadian experiences shared to Filipino artists.
Thank you, Ate Rina Lisa.
And
Or I shouldn't say Ate because I don't know who's older.
yeah, so
I guess it's just a respect.
yeah, that's good. We got an answer here.
Yeah.
TB, tuberculosis.
Okay. Yeah, that is correct. And
Ooh,
who's that from?
this is from Bessie.
Okay, everyone's leading. I like it. I like it. 1 point for Gemelin, for Revelus, for that one, and then Karen
We got
just gave us a
yeah,
Karen just gave us a clap.
yeah.
You should answer, Karen.
Jessa too, just a split second after Bessie, she answered tuberculosis too.
Oh, okay. And yeah, this is not a scam. It's real.
Okay.
um, next question. So I only have 15 questions. So whoever has the highest point wins. Okay. And make sure that you really type fast.
Mhm.
There are two medications that is not available in dry powder and MDI form that I mentioned in the presentation. Can you give an example of that medication? So there are two medication that is not available in dry powder or MDI form in my presentation. Can you give me just at least one medication that I mentioned in that presentation? Go.
All right. We'll take the first one who can answer. We'll give that person the point. The fastest one. So what or state one of the medication that was mentioned on the presentation that is not available on MDI or DPI form.
There's only two that I mentioned.
Okay. They just need to give us one, correct?
Yeah, just give one. And Michael, you're doing the tally, right?
Yes, I am.
Okay, good.
All right. medication that was stated, it's towards the end, that is not available for, it's not available for MDI or DPI form. Basically, not an
Yeah.
inhaler form.
Yeah.
You want to give a clue?
One is used for cystic fibrosis, and one is used as sort of for cardiac issues.
Okay, one is Bessie is epinephrine.
Yeah, that is correct.
Or
Epi is
woo.
correct.
Okay,
So Bessie is correct. So the other one is mucomis. So
okay,
for
good.
cystic fibrosis.
All right. So
Okay.
Bessie is
Next
leading with two
is
points.
Bessie leading? I thought Rebelus Gemelin.
No,
Okay, good.
yeah, yeah.
Okay. All right, next question. Not RT related. Where is my hometown in the Philippines?
Ooh.
Where is my hometown province in the Philippines? I'll give you guys a clue. Last year there was a volcano that almost erupted, or I think erupted in this province. Go.
Oh, all right.
Just the
This
province. I just did the
okay.
province.
Again, we'll give the point to the first one who put a comment.
Yeah.
Okay,
Either
so
or.
type fast. Hometown of Mr. Leonard. And quick, just FYI, we have, I believe we have a RT program in that province. We do have a RT program in that province.
Really?
Yes, we do. Answer, Jessa from Jessa, Batangas.
Yes, that is correct. I'm
All right.
Batanggenyo.
Thank you. Thank you, Miss Jessa. So Miss Jessa has 1 point. I know you answered earlier, but somebody has answered before you. So you
Yeah.
now have 1 point. Thank you. Next question.
All right. This is just a fast typer question. So whoever types fast will get this for sure. True or false? Canada has a private healthcare system. So true or false? Canada has a private healthcare system. Go.
All right. Is Jessa true or false? Come on.
Well,
Type
I want to
fast.
thank you, Michael, though, for doing this. Like it's really good that we, even though we're far away, even though we're in North America, we still manage to you know um, meet with the Filipino RTs. The future, and I'm pretty sure in the next few years or so, we're gonna touch base and see each other. We're a very small profession.
Yep.
Some of you might probably migrate here in Canada, and we'll see each other in some sort of conference, or like I probably might be invited to the California Society of
Oh,
RTs for a
sure.
conference or a speaker or something.
Sure. Yeah.
Yeah,
We can work on that. So now
yeah.
we got a first one to answer. True is Miss Jessa. Is that correct?
No, that is not correct.
Okay. Actually, Jessa, Hannah, Karen, Rebellis, and Gemly answered true. Go.
Nope. Okay, so I guess
Mm.
there's no points on that one. The answer is false. Canada has a public healthcare system, so everything is public. Um, we don't pay anything when we get hospitalized. So from ICU, from labor, from outpatient, from emergency, we're not paying anything. It's free. It's part of the taxes that we pay here in Canada.
Good. Good to know. Yeah.
Yeah.
We're soon migrating to Canada.
I know Bernie Sanders advocated for that one.
Yeah. Next question.
Okay. Um, which Canadian province do I practice as an RRT? So, which Canadian province do I practice as an RRT? Go.
We're waiting for answers. Yeah, it's an it's thank you for I think I would say you're welcome because we created this, group in this page, and more so on this channel, so we could promote and we could, the respiratory therapy profession in the Philippines and share, best practices, and especially this one, we would like to share best practices and education opportunities to our fellow respiratory therapists. And
There you go.
with the technology, we could make it happen. So we appreciate, your time for joining us and sharing your knowledge and expertise. All right, first one to type. I think Miss Jessa um, said Alberta. Is that correct?
Yes, that is correct.
All
I
right.
practice in the province of Alberta.
Okay. Miss Jessa now has 2 points. So Bessie and Jessa, you guys got 2 points each. So make sure, our keyboard warriors, you guys are faster than the other.
Yeah.
Next question.
All right. Next question. So let's head back to the presentation again. Um, so RRT. So remember the epidemiological triangle that I mentioned in my presentation. So the three epidemiological triangle. Where do you think RRTs fall under? So where are RRTs fall under the epidemiological triangle? Is it the susceptible host, the environment, or the infectious agent or source? So there's only three options. RRTs, us respiratory therapists fall under which epidemiological triangle? Is it a susceptible host, environment, or infectious agent or source? Go.
Let's go. Environment. Oh wait, we'll wait for
Who
more. Some more people will answer.
who answered environment?
Jessa.
No, that is not right.
So susceptible host, or what's the other option?
Infectious agent or source.
Okay, Eleanor. Okay. All right. Tell us the right answer. I got multiple answers here.
Yeah, there's only one answer.
Okay. What is the correct answer? And I can tell you who typed
So the
this one.
correct answer is susceptible host.
All right.
So healthcare workers become a host if they're not wearing proper PPEs, right?
Mm-hmm.
So the infectious agent or source then could transmit or carried by the host,
Mm-hmm.
and that would be us or the patient.
Okay, the first one to answer susceptible host is Miss Eleanor Moises. You
Oh,
got 1 point.
congratulations.
Okay, next
All
question.
right, next question. Blank is tiny particles involved in the airborne transmission of pathogens. So blank are tiny particles involved in the airborne transmission of pathogens. It starts with the D and N. So two words, D and N. Go.
All right, D and N. Droplet nuclei.
Who answered that?
Fredilin.
Congrats, Fredelin.
All right. Okay, 1 point for Fredilin. Next question.
Okay. Not the brand name, but the device itself. So again, it's not a brand, just the device. Name the respiratory device that has a dry inhaler form of medication. So give me an example of a respiratory device that has a dry inhaler form. So I'm going to tell you metered dose inhaler is not an example because it's not a dry powder form. So give me an example of a respiratory device that has the dry inhaler form of medication. Go.
You're talking about the device, not the
Yeah, yeah.
drug,
I,
right?
I showed it on my second slide as my intro.
Mm-hmm. All right. Dry powdered inhaler device.
Yeah,
It could be purple, correct?
yeah. It could be purple.
It could be gray. Is it gray?
Could be.
Right? Yeah. That's quite a difficult, and unless you're dealing with it. No, we're talking about a DPI device, a dry powder inhaler device. This might be. It was initially on the slides that he showed. So give it few more seconds. If we don't get a right answer,
Yeah,
then we'll move on.
yeah. And I lied. I don't have 15 questions. I only have 13. So we're gonna be finished early.
All right. I don't think we have a right answer. Can you give us those devices?
So the device that I'm mentioning is the discus,
Mm-hmm.
the turbohalers, so the Symbicords, so those ones.
Mm-hmm.
So the elliptas, so
Mm-hmm.
that's the brio.
Yep.
Okay, all right.
Next question.
Moving on. What does my BMR in my designation stands for? So what does my BMR in my designation stands for? Because I know Filipino RTs, you guys have a BSc, you have a Bachelor of Science. I have a BMR. So what does that it stands for?
Okay. All right.
And yeah, we're only two questions away after that. And now we can declare a winner.
Okay. So we didn't give a point for the discus and
Yeah, because no one
turbo
answered
healer,
that.
right?
So who's leading, Michael?
So we got Bessie and Jessa with both 2 points. Rebelis, Gemly, Eleanor, Fredilyn with 1 point. So I
Okay.
think we need a tiebreaker to have a second and third.
Okay.
We'll pull some questions up in the air
Yeah.
soon.
Yeah. You'll do the breaking question,
Right.
Michael.
All right. What is the BMR stands for on Mr. Leonard's designation? So you got a BSRT, Bachelor of Science in Respiratory Therapy or Respiratory Care. What is the BMR? Can you give them the first word?
Bachelor of Medical.
Okay, what's the R?
What's the
Okay,
R?
here we got a bachelor's degree of medical rehabilitation.
Okay, who said that?
Hannah.
Congrats, Hannah. You got it.
Okay,
Oh my God.
we got a
Yeah,
lot
you
of
really
one,
need.
one
Yeah,
point.
you really need a tiebreaker on this one.
All right.
All right, next question. I mentioned five types of contamination in my presentation. Give me just one example of a source of a nebulizer contamination. So I mentioned five examples of ways to contaminate the nebulizer. Just give me one example of a source of a contamination. Go.
Okay. We got an answer.
Okay.
One is patience.
Okay, that's correct.
Correct. Fredolin. You
Okay,
got
Fredeline's
2 points.
leading. Congrats.
And then um, Gem Lee with airborne contamination. Is that correct?
No,
No. Okay. Good.
no.
So we give the
So
points to point to Fredolin.
yeah, so the answer is healthcare workers, patient, non-sterile fluid that you use for rinsing, non-sterile fluid that you use for delivery of medication, and then inadequate sterilization or disinfection.
Okay. So we give Fredolin with 2 points. Do you have more questions?
One more question.
All right.
So who's leading? So I guess
So
there's now a lead, right?
we got a tie. Fredlin with 2 points, Jessa with 2 points, Bessie with 2 points, Rebelis. Uh, um, Rebelis with 1 point, Jem Lee with 1 point, Eleanor
Oh,
1 point,
okay.
and
Okay,
Hannah
I
one
guess
point.
whoever types this first, you guys know this. What does AGMP stands for? Go. What does AGMP stands for? Go, keyboard warriors.
Yeah. 4 words. AGMP. You guys are doing great. AGMP. AGMP. Okay, we'll give you a clue. What's P stands for, Leonard?
Procedure.
All right. Now you got 3 words to figure out. Oh, here. Fredolin, aerosol, generating medical procedure.
Correct. That is correct.
Woohoo!
Okay, that's it.
All right. So we got a. This is your last question, right?
Yeah.
Okay, we have a winner.
Who's
And
the winner? Drum roll.
winner is winner of 5,000 Philippine pesos is Fredolin with 3 points.
Congrats, Fredelin.
All right, but
So,
we need a tiebreaker for the
so
next.
you deal with the tiebreaker,
Right.
but Fredelin, if you wanna connect with me on Facebook,
Okay. I'm gonna type in your name on the chat box.
yeah, sure.
Lynard Higoy. And then you
I
guys
think
know his face from this YouTube live, so make sure you add that person.
yeah, and then if you're in the party group,
Mm-hmm.
I just recently posted there, so you'll probably see me there too.
Mm-hmm. So actually, this is what we're gonna do. So I'm not gonna do a tiebreaker. So we got Bessie and Jessa as our second and third placer. So um, the 5,000 is sponsored to us by. Thank you for your generosity, Mr. Leonard Higoy. Congratulations to Fredolin and our 1,000 Philippine pesos from Ang Artimo Show is going to Bessie and Jessa. Please connect with Ang Artimo Facebook page. Send a message, um, and then connect with me so we can send you guys the funds.
Yeah, and then the first prize connects with me.
Right. Awesome. Thank you. Thank you. Thank you. Thank you so much for
Oh,
your
you're
time.
welcome.
Um, do we have any more questions for our audience? Thank you for, you guys have any more question? Oh, let me tell you about Miss Rina Lisa Bugzulen real quick. She's a good friend and ading or auntie to me. She's a program head
Not
at,
sure they added me.
yeah, she is, yeah, she did. She is a program head from Pine City College, which produced a lot of our top notchers on the recently concluded RTRP licensure examination. So thank you, ma'am, and um, she's very supportive of us and our shows, and her students have joined us on today's episode. So thank you so much. Let me just give a shout out real quick to our top notchers. Um, um, or actually, no, I'll do a just a separate video on this. But thank you to good job to all top notchers
Yeah, thank you.
from our University de Zamboanga, Pine City College, University of Perpetual Help, both Las Piñas and Laguna, Emilio Aguinaldo College, um, Cagayan State University, Lorma College, Far Eastern Nicanor Reyes Medical Foundation, and that's about it. Mary Childs and St. Jude College, Manila. Good job, guys. This is what I'm gonna do for the party and ang Artimo, um, and I believe few people will join me with this cause. Find us the top one, Mr. Raynor Amil Hamja Nebab. If you know Mr. Raynor Amil Hamja Nebab, our top one for the recently concluded RTRP licensure examination. Have them contact us on Ang Artimo. We have a special um, surprise for you. All right. I don't think just if you Mr. Leonard, if you want to give a shout out to our Pine City College students and program head.
Um, Hello, everyone. Pine City's colleges is in Baguio, right?
Yes.
Yeah. Hello, everyone. Hello to the profs. Hello to the students. I'm really hoping that this pandemic will be over and I would be able to join you guys for your Philippine conference. I'm really hoping. Um, I don't know if Sir Noel is here. Maybe I can get an invite and hopefully it'll be coincide with our annual vacation in the Philippines.
Mm-hmm.
Yeah, I'll definitely go there and just kind of chit chat. I know Carolyn and Andrew West is very active with going there, so then I won't be alone because I already work with those fantastic colleagues of mine. So
All
yeah.
right. Yeah, thank you. And any more words before we let you go? On behalf of everyone who are joining us today, in behalf of ang Artimo show, in behalf of the Filipino Association of Respiratory Therapists International, in behalf of all the respiratory therapists that are supporting us with our advocacy and promoting the profession, promoting the Filipino respiratory therapists worldwide. We would like to thank you, Mr. Lynard Higoy, for your valuable time sharing your expertise and your knowledge and everything that you're doing for the profession. And you are, supporting us with our cause. Thank you so much.
Yeah,
And
you're welcome. Right back at you. Thank you for promoting and advocating for the Filipino RRT. So that's good.
pleasure. All right. All right. Anything else, Mr. Higoy, before we let you go? I know it's 11:30 at night there now.
No, no worries. It's a Saturday, so
Mm,
all right. Thank you so much, guys.
mm. All
I hope you
right.
enjoy the show.
Thank you, thank you. And then we'll connect afterwards. Thank you.
Okay, thanks, Michael.
Yeah, you're welcome. Thank you.
Okay, bye.
All right. So we just had Mr. Leonard in our today's episode. Thank you for joining us today or tonight with our show. And thank you for all our supporters, audience. This is the most views we had and most participation. And we do thank you, Miss Rina Lisa, for having your students here on our educational show for tonight. And we truly appreciate the participation from your students. So we would like to invite and encourage our fellow respiratory therapists on your Sundays in Manila or Middle East and Saturdays for us here on western side of the world. If you are free around 11 a.m. or 12 noon in Manila, or around 7 or 8 a.m. in the Middle Eastern countries, about 8 to 9 p.m. for us here in Northern America. Um, Please join us for our next episode for next week for another exciting episode of Ang Artimo. So, thank you so much. If you have any questions, concern, comments, suggestions with what topic you want us to discuss next, please leave us a comment on Ang Artimo Facebook page or the party Filipino Association of Respiratory Therapists International Group. Please give us a comment or give a suggestion, and we will gladly take it into consideration. And we invite our universities offering bachelor's respiratory therapy to have your students join us on their weekend. I know you guys have enough of your online modules, but join us because we are giving perspectives on the bedside, and also and as well as textbook perspective of the respiratory care in in our current practice. So join us for the next episode next week of Ang Artimo. And definitely, Dr. Noel Tiburcio, Mr. Benji Aglim, and Mr. Lynard Higoy, you guys are officially ma RT, my respiratory therapist. So thank you guys for joining us today. Please connect with me, Miss Fredilyn. Connect with Mr. Leonard Higoy. If you can't reach him, connect with me. And Miss Jessa and Bessie, please send me a message, and we will send you your winnings. Thank you so much for supporting us, and hope you guys have a great day, great Sunday, great Saturday, great night. Thank you for joining us. And again, yeah, I'm your RT respiratory therapist, ang RT mo, Michael De Peralta. Have a good night.